Hi, Dr. Vo here. I'm a cataract and refractive eye surgeon. If you're thinking about having cataract surgery, then one of the most important decisions you'll have to make is to decide what lens implant to get. Most patients likely will consider getting a monofocal lens implant since it's the cheapest option available. However, you've probably been told that if you get this lens, you will likely need reading glasses after surgery. What if I told you there was a way you could reduce your need for glasses even with a monofocal lens implant? You could have one eye set for distance and the other eye set for near. This is a strategy called Monovision. Some patients will love this, others will hate it. In today's video, I'll go over in more detail about who might be a good candidate for monovision correction and what factors you should consider before committing to this option. As discussed in my previous videos about the different cataract lens types, remember that a monofocal lens has a single focal point. Most patients will choose to have their distance vision corrected and then wear reading glasses for intermediate and near work. To improve vision at distance, intermediate, and near, a multifocal lens would usually be the best option. However, even with a monofocal lens implant, we can increase a patient's depth of vision by utilizing a strategy called Monovision. With Monovision, we set each eye to a different focal point. One eye, usually your dominant eye, is focused for distance. The other eye, usually the non-dominant eye, is focused for near. So instead of having both eyes focus at the same distance, one eye will be used for distance-related tasks and the other for near vision tasks. So why would someone want to choose Monovision? Monovision is an excellent choice for patients who want less dependence on glasses after surgery. This is not only a cost-effective option for patients, but it can also reduce halo and glares that you may experience with a multifocal lens. The main drawback of monovision is that it can feel strange at first. Patients sometimes report feeling imbalanced, or they may feel that their vision is not as sharp. Our brains, however, can adapt through a process called neuroadaptation. This can take weeks or months, but not everyone will be able to adapt. This is why I usually recommend patients who are seriously considering monovision correction to trial it first with contact lenses. This will give you an idea if you like how it feels before committing to it. So, who is the ideal candidate for monovision correction? Number one, if you've worn monovision contact lenses before or have had monovision laser correction. Number two, you don't need perfect depth perception for your job. Number three, you're okay with a small compromise in visual sharpness. Number four, you mainly want functional vision but don't necessarily need perfection. You should not choose monovision correction if 1. You're sensitive to having each eye see differently. Number 2. You want crisp, perfect vision at all distances. Or number 3. You do activities that require precise depth perception. This may include things such as night driving, golf, or if you read extensively. When it comes to choosing between monovision versus getting a multifocal or extended depth of focus lens, which should you choose? If your goal is to have the best vision possible at both distance and near, you're okay with spending extra money, and number 3, you don't mind the possibility of halos and glare, then I would say choosing a multifocal lens would be the best option possible. However, if you want to avoid extra out-of-pocket costs, you want to minimize the risk for halos and glare, but you want more depth in your vision than a standard monofocal lens can offer, then I would say monovision can be an excellent choice. If you choose to have monovision but don't like it, or if you can't tolerate it, don't feel like you don't have any options and have to live with it forever. You can wear glasses to balance each eye out. You can consider having LASIK enhancement, or in rare cases, you can request to have a lens exchange and have the lens swapped out. Of course, you want to avoid these situations if possible, so it's recommended to trial monovision with contact lenses first before you commit to it. Monovision remains a cost-effective method for reducing your dependence on glasses after cataract surgery. However, it's not the right choice for everyone. Make sure to try it out first with contact lenses before committing to it. Be sure to have a thorough discussion with your surgeon so that they can review with you all the options available. If you found this video helpful, please make sure to like and subscribe. If you would like to learn more about cataract surgery, check out this video on the screen next. I'll see you in the next video. Take care. Bye.